Good evening, everyone. My name is Elizabeth, the Education Coordinator for Marlene's Market and Deli. Tonight's special guest that we have with us is Dr. Rachel Herron. She is a physical therapist at Northwest Wellness Center, located in Federal Way, Washington. And it's always a pleasure to work with her and the Northwest Wellness staff. Thank you so much, Dr. Herron.
Thank you, Elizabeth. I appreciate the introduction, and I'm going to go ahead and share my screen now. All right, so let's see. And I do think when I share my screen, I can't see the question. So Elizabeth, do you mind letting me know if a question pops up in the middle of while I'm speaking, please?
Yes, I can definitely help you.
Thank you. Okay, everybody, so let me put this in presentation mode. Again, my name is Rachel Herron. I use she, her pronouns, and tonight I am here just to speak with you all about physical therapy for pelvic organ prolapse. My presentation today is going to be tailored to those assigned female at birth with that anatomy, though anyone is welcome to watch, anyone is welcome to ask questions about themselves, their partners, just really any topics they have about physical therapy related to pelvic health. So a little bit about me. I am an orthopedic and pelvic health PT at Northwest Wellness, so I work with people experiencing all sorts of symptoms from urinary leakage to difficulty with bowel movements, constipation, painful sexual intercourse. I also get to work with folks who have low back pain, knee pain, sports injuries, recovering from a shoulder surgery, things like that. The clinic I work at is a multidisciplinary holistic health clinic. I'm pretty sure my boss is on here supporting me tonight. Dr. Nichols is the CEO and founder of Northwest Wellness, and the clinic that we operate out of offers services for not only pelvic health physical therapy and orthopedic physical therapy, but also chiropractic care, naturopathic medicine, massage therapy, and acupuncture. So it's really nice to be able to offer all those services in one place and have patients get that seamless care. My educational background, so I earned my Bachelor of Arts from Colorado College, which is in this small town called Colorado Springs, a couple hours south of Denver. While I was there, I majored in cellular molecular biology, and I double minored in Spanish and kinesiology while also playing Division I soccer. I then went on to earn my doctorate of physical therapy from Pacific University in 2020. Shortly after that, I got my job here at Northwest Wellness, and since then I have completed 80 hours of continuing education through the Herman and Wallace Institute to help me better be able to serve my patients who have pelvic health physical therapy needs. And then just this last summer, I also became certified in Reiki levels 1 and 2, and that's something I also really enjoy. Okay, so game plan for today, I'm going to start off talking a little bit about anatomy so that we're all using the same language. I don't want to assume that anyone here knows anything. I don't think, well, let's put it this way. I think there's lots of room for improvement in our education system around pelvic health for people assigned both male and female at birth. And long term, I have this dream that some of this, content, like not quite to this level, but some of it would be offered, in those sex ed courses that we all experienced in middle school and high school. I think that would be really helpful. So after anatomy, I'm going to talk about the 5 main functions of the pelvic floor, because there's so much that our pelvic floor does for us. It's really important to know that. I will then dive more into the symptoms of pelvic organ prolapse. Really quick, pelvic organ prolapse, if you didn't read the article, is just when one or more of the pelvic organs begins to descend down the vaginal canal, either into the vaginal canal, and sometimes in more severe cases, outside of the vaginal canal, at least what I do with my patients during pelvic floor muscle exams. And then I will talk about some treatment options for pelvic organ prolapse. One of the biggest things that I hope everybody watching tonight or later in this recording gets out of this presentation is that if you or a loved one has symptoms of pelvic organ prolapse, There are lots of options to receive treatment, and I hope that you feel empowered to ask one of your healthcare providers about the symptoms, and just know that just because you've had these symptoms and maybe even a healthcare provider has told you there's nothing you can absolutely do for it, or maybe your only option is surgery, I hope that you'll feel after this presentation like there are more options than that. And then we'll finish up with a Q&A, which will be an opportunity for y'all to ask questions. Do feel free, please, to send in the chat questions as I speak. You can also send Elizabeth a message if I start talking a little bit too fast. I do get very excited about topics of pelvic health, and sometimes that makes me talk a little faster. And then again, if you have more personal questions, you can save those to the end, and we will stop the live stream for those. So a little disclaimer before we get started. Like I said, the intention of the presentation is to offer information that will empower you to seek a medical exam by a qualified provider. This presentation is not intended to diagnose or offer formal treatment for anyone watching. Some examples of providers that you could seek care from after this presentation includes pelvic health physical therapists, gynecologists, urogynecologists, your primary care provider, and sometimes naturopaths who do gynecological exams. Which, by the way, we have a naturopath at Northwest Wellness, new to our team, Dr. Megan Rourke, who does do gyne exams. Okay, so on to a little bit of anatomy. If you can see my cursor here, I know it's a little tiny, so I'll try to move it slow. Let's start over here on the photo on the left side of your screen. So the first thing I'll draw you to is this skinnier bone line here. Those are from the lumbar region of the spine. So these are lumbar vertebra. This is going to be L5 at the bottom here. Just above that, we have L4 and then L3. We're looking at the front of a person here. Below the lumbar region, you're going to find this triangle-shaped bone called the sacrum. So when folks say they have SI joint pain or sciatica symptoms, a lot of times there's some sort of dysfunction going on in this region or this region here, as well as the lumbar spine. At the bottom part of this kind of pizza-shaped bone, it's dinner time, I'm getting hungry, is this little bone called the coccyx, also known more commonly as the tailbone. And then if we go out to either side, you're going to find these fan-shaped hip bones called the ilium. We have a ton of muscles that attach to these bones as well. The hip bones circle around up front here, and this is why this area is sometimes called the pelvic girdle, because it connects all the way around, at least we hope that it does, when there's not an injury going on, and so it makes up the pelvic girdle. And then if you come down to the bottom here, this green-shaped bone represents the ischium, which is more commonly called the sit bone. If you take a hand right now and place it under one of your butt cheeks, and kind of wiggle around until something bony presses into your hand, that's how you know that you're on the sit bone. That's an important landmark that I use when I'm doing pelvic floor muscle exams, because a lot of times the sit bones align with a couple different muscles, so it gives us some information on if the muscles are a little bit elevated, a little higher, or have dropped down a little bit. And sometimes they drop down a little bit if the pelvic organs have come down a little bit and they're kind of sitting on those muscles and weighing them down. And then over here, we've got the femur or the thigh bones. Now, this image over here to the right, let me orient you. So we're looking at the side of a person. Up front, this is the front of them. This is their tummy area. And then this is their bottom. So this spine part, this is the sacrum, that triangle bone coming down to the tailbone here. If you go back over to the front of the person, you're going to find the pubic bone. And then this hot pink color, one of my favorite colors, that attaches from the pubic bone all the way back to the tailbone, that actually represents the pelvic floor muscles. And then here is a view of a few of the pelvic organs. So this yellow one here that represents the bladder. Then we have the uterus, which is sitting on top of the vaginal canal right here. And then next we have the bowel, or sometimes called the rectum, which then goes down into the anus. So the anus, this is where feces or poop is going to exit, ideally. And then if we go back to the bladder, this skinny little line here represents the urethra, which is our hose where pee will come out. And then again, this is the vaginal canal. So going through here, you can see that there are 3 openings, the one for the urethra, second one for the vagina, and then a third one for the anus. Okay, here is a bottom view of the pelvis. I'm going to give you a second example on the next slide. The bottom view is oftentimes a view that I have when I'm doing a pelvic floor muscle exam with patients. It's also the view that a lot of gynecologists have. So just to orient you again, here is the top of the person. So this is the pubic bone or the pubic joint right here. And then if we go down here to the bottom, here are the ridges along the sacrum, and it comes all the way into the tailbone. And then we've got a sit bone here, another one here, and these holes represent where the thigh bones come in and connect to the pelvis. I like this view a lot because it already starts to show how layered the pelvic floor muscles. All this pink region and white area represents muscles. These are some really strong ligaments that offer a lot of support to this region. This little circle here represents the muscle around the anus, the external anal sphincter. And then we've got some more muscles here. It's in this region that we're going to find the hole for the vagina and also the hole for the urethra. And then overlying tissues here would include the clitoris. Okay, so a little bit more into anatomy. There are 3 layers of pelvic floor muscles. Each muscle has slightly different function. We don't need to memorize any of the muscles. That can be kind of daunting, but the most important takeaways is that layers 1 and 2 play a big role in urinary continence. That means they play a role in us being able to hold back our urine. They also play a big role in supporting the vagina, the vaginal canal, which means they're also going to support pelvic organs. This means that because there's some weakness or poor endurance in the muscles, specifically within layers 1 and 2, layers 1 and 2 also serves as the attachment site for several other muscles. That's because we've got the perineal body in this region, and there's a few layers to that, but you can see like this muscle here attaches to this region, and also it attaches to the external anal sphincter. This perineal body is an area where sometimes, unfortunately, during vaginal birth, there can be some tearing or where an episiotomy, I always have difficulty rolling that word off my mouth, or off my tongue. There can be a little bit tearing there, and I think with this picture, you can see why that can be really hard on an individual who does have that injury during birth or has an injury after surviving something like a sexual assault or some type of direct landing injury on this area of their body. Because if you injure this perineal body area, you're subsequently impacting all of these muscles which attach to it. A couple other important muscles here. So the ischiocavernosus, or I guess just one other muscle, the ischiocavernosus. This is an important muscle that when it's functioning optimally can be really helpful in pumping blood up to this yellow dot here, which represents just the tip of the iceberg of the clitoris. So it plays a big role in sexual function and sexual arousal and orgasms. Okay, layer number 3, that is known as the pelvic diaphragm. It's a really resilient layer. This layer plays a big role in fecal continence, so holding back poop, also holding back gas when we don't want to fart. This layer helps lift the pelvic floor. It helps support the pelvic organs. It also resists increased intra-abdominal pressure. Like, big word there. What is intra-abdominal pressure? Well, what I mean by that is, so our abdomen or tummy region, when we cough, for example, or sometimes I go hold breath in there, or I strain when I'm pooping, those are things that are going to increase pressure in that area. This pressure system, what happens is if I let air in and I don't really have good control of my pelvic floor muscles, sometimes that pressure can just gently press down on the pelvic floor, press down on the pelvic organs. And so when the pelvic floor muscles are functioning optimally, what they're going to do is just really resist that pressure. They're going to hold steady no matter what happens. When there's weakness in these layers, this can be why folks say, when I sneezed or I coughed, a little bit of poop came out. When I sneezed and I coughed or I jumped, a little bit of pee came out, because the pelvic floor muscles aren't doing what that person needs their muscles to do to resist that increased pressure. Hold the muscles tight around the urethra to keep pee from sneaking out. Hold the muscles tight around the anus to keep poop or gas from sneaking out, and to offer enough support around the vaginal canal to prevent the organs from gently leaning in to the canal. Another cool function about this layer is if we were going to be a dog, which I have to do a little shout out to my puppy because Elizabeth, you don't know this, but since I presented last year, I now have a new puppy who's 9 months old. His name is Luca. I'm in so much love. And so I have been really appreciating relating like the tails of dogs to the tails, our imaginary tails on humans, because if you think for a second about like a dog when they're scared or they're anxious or uncomfortable, they commonly tuck their tails down, right? Well, humans, we don't have visible tails, but we have a really similar physiological response, meaning that when we are scared, watching the news, experiencing stressful situations, for people assigned male and female at birth, it's very common for our invisible tail to tuck down. What that means for us is that this tailbone here actually, in this image, this is a bird's eye view, the tail actually comes forward a little bit, which, as you can see, look at how many muscles attached to this tail region right here. So if this comes forward right here when we're stressed, you can imagine how it shortens all of these muscles. And then when we want it to extend later on, when hopefully we're not stressed, the muscles might be like, what the heck? We've been in this like bent position all the time. And now you want me to stretch out and support the pelvic organs in this position. And this is just another reason why it's really important when you have symptoms of pelvic organ prolapse to get a thorough exam by a qualified medical provider, because it's really not as cut and dry. Every person is not textbook. Every person is not the same. People can have different reasons or causes that are contributing to their symptoms of pelvic organ prolapse. And a lot of times there can be an assumption that if someone has pelvic organ prolapse, they have all of this looseness in their pelvic floor or their vagina. There can be a stereotype that as people assigned female at birth age, that or if they had kids, it's just going to happen. It's just what happens to your body. This is just the cost of having a baby, and no one talks about it. And you're just supposed to experience these symptoms all the time. I'm saying this sarcastically for those who don't know me well enough to know when I'm being sarcastic. But really, sometimes people actually have tightness in their pelvic floor muscles because that tail is tucked and they're stressed out a lot, or maybe their pelvic floor muscles have sensed that the organs are descending and and that's not a good feeling to have something falling out of your vagina or feel like it's falling out. And so the muscles try to serve the body, try to protect you, and they're like, whoa, something is falling out here, so we need to tighten up. We need to everybody hold on as tight as you can. But then what sometimes happens is folks can get pain in this area. Think about any other area of your body, your neck. Oh my gosh, I got neck pain, and someone presses right there. And it's like, whoo, that's a tender spot. Or I'm stressed and my neck is tight and now I have a headache. Well, we have all types of headaches in our pelvic floor. I'm just hoping that with presentations like this and conversations with your friends and family, that in time, more people are going to be aware of the headaches of our pelvic floor. And one of those I feel is pelvic organ prolapse. Lastly, layer number 3 also helps with sexual function. Okay, so zooming out a little bit here, this image represents a view, outside of the body. So just perspective here again, here's the top of the person. So here's the pubis, the mons pubis, that overlies where the pubic symphysis or pubic bone is. Down here, this would be the bottom of the person, the back of the person. This right about here would be the tailbone, the coccyx. We move up, we have the anus. Here's the perineum, that overlies the perineal body. Remember, the perineal body is that mega attachment site for lots of muscles and other tissues. This area right here is known as the vulva, though I will say, growing up, and then, even with a lot of, people I interact with still, we refer to this area collectively as the vagina, but the truth is the vagina is just the vaginal canal. There's an opening to it, the canal that goes on up, but this whole area is really actually called the vulva. And then getting a little bit more specific, we have the labia majora, which are going to be the outer lips, which can kind of cover the opening to things. And other people, there's so much beautiful diversity in anatomy here. Other people, the labia majora can be open, so you can actually see everything. The labia majora are typically the tissues that might have a little bit of hair on them. And then inside to the labia majora, we're going to have the labia minora, and then here we've got the urethral opening where pee comes out, and then here we've got the clitoris. There's also can be a little hood over the clitoris that can kind of well, like a sweatshirt hood, go over the clitoris, and then the opening to the vaginal canal. It's important to know your anatomy in this area because later on I'll talk about the value of doing self-checks, and by that I mean, you know, a lot of people who have breasts are encouraged by doctors to do a breast exam regularly to screen for, you know, breast cancer or something that's changing the body. Well, it's possible to get cancer in this area too. It's also possible to have other things going on in this area like infections or dryness, irritation of the tissues, and so it can be really beneficial to once a month or at least a few times a year grab a mirror, look down at this area. I know some people watching as I'm talking about that, you might be like, oh heck no, I am not doing that. I totally respect that. I also can appreciate that this is not something, I mean, I didn't grow up being encouraged by people or doctors to do this, but now that I've educated myself in this area, I really do see the importance of it and see the importance of people connecting to their pelvic floors if they really want to address their symptoms of pelvic organ prolapse. And so later on, I'll talk about how you could do a self-exam with a mirror. Okay, so quickly we'll go over the main pelvic floor functions, the 5 S's. So support, sphincteric, sexual, stability, sump pump. Well, I already talked a little bit about sexual. If the pelvic floor muscles are too tight or they're too loose or they're too weak or you know, they're just, you're having a hard time connecting to them, well, then they might not work as you want them to during sex. This might mean that they don't stretch the way you want them to and expand, have flexibility. That can cause some pain during sexual intercourse. They may not pump blood and move fluids the way you want them to, produce lubrication, help with sexual arousal and orgasms. Sphincteric, well, that refers to like a closing of things. So the 2 main areas here would be like the urethral sphincter closing around the pee hose, and then the anal sphincter closing around the anus to hold back poop or gas. Support, well, we're literally talking about pelvic organs this whole presentation, so they support those. They also offer a ton of stability to our body. If you think about the pelvis for one moment, if we tangent over to houses really quick, which, you know, crazy housing market right now, but I'm not going to tangent on that. But if you just picture like any house right now and you think about like the foundation of it, it's interesting. I live over in the Auburn area, and you know, we kind of have some more flooding that goes on, right? Especially with rain, and I see, so a lot of the houses have been built up out of the ground a little bit so that like if there is flooding, you know, hopefully it doesn't come up to your door. But with that, I can see the foundation of a lot of houses quite well. And unfortunately, with the land changing, right, some of the houses are slanted a little bit, and you can see how things are not level with the foundation. Well, if you could imagine for a second, like if you can consider how important the foundation on a house is for everything that goes on in a house, imagine for a second that your pelvis is the foundation to your entire spine and your entire body. So if the pelvis, if there's a little bit of misalignment in the pelvic joints, like if one side is tipped forward a little bit, if one side is opened a little bit to the side, if the muscles on one side are a little tighter, if the tail is tucked, right, and those muscles are a little tighter, you can imagine how that foundation of the pelvis can have this trickle up effect on the rest of the spine. So a lot of times folks might think they have no pelvic health symptoms, but they have low back pain, and they're, you know, it just won't get better. It won't get better. It's really impacting their quality of life. Back pain is actually one of the leading causes of disability worldwide, and maybe their back pain is actually related to some pelvic floor muscle dysfunction or some dysfunction in the pelvic joints, or maybe it's actually related to an undiagnosed pelvic organ prolapse where the organs are falling down, and so they're gently pulling on the ligaments that hold up the organs, and that is referring pain to the low back or the low tummy area. Okay, some pump, all that means is that there's a ton of blood vessels, lymph nodes in the pelvic area. Those are just different structures in our body that help filter fluids, pump oxygen around, pump nutrients around. Just like you may have heard, like in our calf, if you walk around, that helps circulate blood up to your heart after a surgery. The reason most doctors don't want people to be too sedentary and lay down, they don't want to risk a blood clot, so they encourage people to either do calf pumps, gas pedal their feet up and down, or if they're able to get up and walk around, that's because when we walk around, we pump the blood back up to our heart and recirculate it. Well, a lot of the arteries in our pelvic area function similarly, and they're really important. Lastly, posture and breathing, as I reassess my posture for a second. Everyone take a deep breath if you can right now. Just like our belly or our chest can expand or our ribs can expand when we take a deep breath, our pelvic floor actually also has the capacity to gently expand and relax when we take a deep breath. Although it's not commonly utilized in that way until we really train ourselves how to do that. But again, posture, if you're someone who's been having this chronic upper back pain or shoulder pain or neck pain, and you feel like you're I could really work on my posture. If you're only addressing your neck posture or your shoulder posture, but you're leaving out that sacral region, the tailbone region, your pelvic region, that could be one of the reasons why you haven't, fully achieved the goals that you want. Okay, so let's talk about pelvic organ prolapse. Just quick peek at the time, we're doing okay. So common symptoms, sneezing and coughing makes it worse. Again, that's that repeated increased intra-abdominal pressure. So sometimes people are like, well, I was fine, but then I got a cold and I sneezed and coughed for 3 days straight, and now that thing is happening again. I can feel something moving in my vagina. What is that? Otherwise, people are like, my vagina is falling out. Some people say my stomach really hurts again because it can refer pain to that area. Some people say, oh, geez, it feels like there's a tampon in there, but I checked twice and there is no tampon in there. Otherwise, just pressure heaviness in the vagina, pain in the saddle area. Saddle area is the area where they would be in contact with a bike seat or a horse saddle. Bleeding can happen, especially in circumstances where the cervix, part at the bottom of the uterus has fallen out of the vaginal canal, because these tissues are not intended to be in contact with our underwear or pants clothing material. And sometimes when they are, when we're walking around, a little bit of friction can happen, which can irritate the tissues and cause a baby wound on that structure and leave a little bit of blood residue on your clothes. Other people might say, I have to put a finger in my vagina when I poop, or I have to take my hand and press it up on the perineal area, the vulvar area, when the pelvic organs are coming down, especially the rectum. I'll show you some pictures of this in a minute. What can happen when someone tries to poop is they poop, but the poop gets allow the poop to get stuck in that area. Okay, a couple more specific symptoms. So there's 3 main types of prolapses, which I'm going to get into in a minute. Bladders is one of them. Some more specific symptoms of that might be if you have a weak urine stream, you have a hard time starting the flow of urine, you have a hard time keeping the flow of urine. And this is a little bit of a blurry photo. I promise I have a better one coming up. But the reason that is because if this is we're looking at a side view of a person. So here's the front of them, here's the back of them. In some more severe cases, this bladder can kind of gently lean one way or the other. I'm typically leaning backwards into the vaginal canal here. And what it does, if it leans far enough, it can kind of cause a baby, not a kink in the urethra, the pee hose, but it can cause an uphill situation and make it a little bit harder for the pee to come out. And then some people feel like they need, or they'll say, well, I peed and then I stood up and then there's this dribbling that came out afterwards. I thought I was done, but I wasn't. And then more urine leakage when you're sneezing, coughing, and laughing, which is called stress incontinence. More specific symptoms to a rectocele. And I know you're like, what are these types of prolapses? I'm gonna get there, I promise. But a rectocele is when the rectum prolapses are three. So a rectocele can feel like there's pressure on the back side of the vaginal canal. It can feel, again, like you need to reposition, move around during a bowel movement. You can feel like when you poop, like it doesn't all come out. So up here is some, I don't really like the term normal anatomy, but we will use it for the purposes of this presentation, just because everybody's different. But here is the rectum. And so it kind of lands right above the anus. But in this bottom picture, again, front of the person here, back of the person here, you can see that the rectocele has pocketed a little bit. It's actually squishing the vaginal canal a teensy bit, but it's almost like as the poop is like coming down here, and then it can bypass the anus and get stuck over here and not want to come out as directly, which is why if someone inserts their finger right here and pushes backwards like that way, it can sometimes help the poop come straight out. You could also, people might be having pain with sexual intercourse, again, like it's kind of closing down the space to the vaginal canal, or fecal incontinence, difficulty holding back your poop. Splinting is just the formal term for when I was mentioning like inserting a finger into the vaginal canal or applying pressure to the saddle area. A uterine or enterocele. I'm not going to talk a ton about enterocele, but that does happen. We'll talk about uterine first. So uterine symptoms, again, those could be bleeding, like on your underwear, low back pain that gets worse as the day goes on. You might notice like, I have this pain, but when I lay down, it's fine. And that's because we've taken gravity out of it and the weight of the organ's not pulling down so much. And so the muscles don't feel like they have to fight quite so hard to hold everything up. For that same reason, you might get more pain when you're standing if you have a uterine prolapse. For uterine prolapse, you could have difficulty emptying both the bladder and the bowel, and you might feel like that generalized pressure. If we go up to this top photo here, this area, right, well, sorry, let me orient you again. Front of the person, back of the person, here's the pubic bone, back here is the tailbone. This is the string of pelvic floor muscles that goes across, and we've got the bladder up front, the uterus up front, and then the rectum. I was practicing this presentation this weekend with my mom. It's really nice, so she's helping me. And she told me I talk really fast. So I was just reflecting on that for a moment and trying to repeat things some more. But this area right here is called the pouch of Douglas. And you can see there's part of the intestine up here. So sometimes in more severe cases, what can happen too is the intestine can actually come down into this pouch of Douglas area. And that's represented in this photo over here to the right. And so the squiggly line is the intestine. And in those more severe cases, that might not bulge directly out of the vaginal canal. It can kind of bulge over that perineal body area. It can also be severe enough that it does press out in the vaginal canal, kind of like a rectocele or rectal prolapse would. Okay. So I've already said this, but just to repeat it, because this can be a really complex thing to understand. Pelvic organ prolapse is simply referring to the descent of one or more pelvic organs into the vaginal canal. I'll show some more specific pictures in a second, but in general, if we think about, I was considering using my pelvic model for a second, but I think my face is kind of small in this presentation right now, so I'll wait for the photos. But if we think about a person, okay, so here's front of the person, here's back of the person. Elizabeth, please let me know if my hands are in the picture because I cannot see my face. But front of the person, back of the person. Okay, here's the pelvic floor down here. Well, up front is the bladder. Okay, and then we have the uterus, and then we have the rectum. So if this is the vaginal canal, okay, this is the uterus. If the bladder gently leans back into the vaginal canal, that would be a cystocele. If the uterus gently falls down the vaginal canal, that would be a uterine prolapse. And if the rectum gently leans from the backside in, that would be a rectocele. Okay, so here's some clearer pictures. Let's start over to the left again. Y'all, you're gonna have this down pat by the end of this presentation. So front of the person, back of the person, here's that awesome pubic bone, Then we've got the sacrum and the tailbone back here. The pelvic floor muscles is the sling across. So we've got the bladder in the front, the urethra here, the vagina, the vaginal canal here, the uterus here, and then the rectum. So if we move on to this example, cystocele, that's bladder prolapse. So in comparison to the leftmost photo, you can see the bladder has gently fallen back a little bit and is squishing the vaginal canal a teensy bit. So when I do an internal pelvic floor muscle exam and I have my finger inserted into the patient's vaginal canal with glove and lubricant, of course, what'll happen when I insert my finger in is I can feel a little bit of pressure on the top of my finger when a person bears down, and that's the bladder, okay? When I insert my finger and I feel a little pressure coming down like the tip of my finger this way at me, that would be a uterus prolapse here. So you can see in this photo, look how much shorter the vaginal canal looks, even though it's still just as long, but it's just that the uterus has dropped down a little bit compared to this one over here. And then this last one, here's the rectocele. So again, here's the rectum. We want poop to come out, but shoot, here's some poop stuck right there. This one is not actually showing too much of the vaginal canal being squished, so it would be like a lesser grade, and I'll talk about what grades mean in a second, but we really, this makes it a little bit easier for poop to pocket there. Okay, so grades of pelvic organ prolapse. You may have been told by a doctor or heard a family member say, I have a grade 1 pelvic organ prolapse, I have like a grade 2 pelvic organ prolapse. Well, we make a grade based on basically how far the pelvic organ is coming down the vaginal canal. So I'm going to use the uterine prolapse as an example here. The uterus, when it falls down in the upper half of the vagina, we can call that a grade 1 or stage 1. When it falls down to the opening of the vaginal canal, we can call that a stage 2, a grade 2. And then when it falls out a little bit, like externally, more than a centimeter out of it, that's considered a grade 3. And then when it falls out like much larger than that or entirely, that would be a grade 4. So you can have grade 0 to 4 for a bladder prolapse, a uterine prolapse, or a rectal prolapse, and then also the enterocele. Okay, so quick, I got a few studies here from you. I think that it's really important, whichever provider you choose, to go to someone who's like up to date on the latest research on things, because treatment for pelvic organ prolapse has changed so much, and I suspect will continue to change. But there's a really cool study in 2014 that found, they looked at 9,000 people who were 1 year postpartum after giving birth. And what they found is that 70% had a rectocele. Remember, that's the rectum coming into the back wall of vaginal canal. 90% had a cystocele, which is the bladder leading into the front wall of the vaginal canal. And then 89% had a uterine prolapse, which is the uterus dropping down, coming from the roof or the ceiling. Now, of note, all of those people, right, 70% and up, 65% of them had a grade 2 prolapse. So remember, that is the grade where the organs are basically descending enough that they're just at the opening of the vaginal canal, or the hymen, if you're familiar with that term. But here's the kicker, 80% of those people were asymptomatic. That means they did not have any of the symptoms I've described before. So kind of like they were undiagnosed with pelvic organ prolapse. So on one hand, this is really cool, because if you've been told you have pelvic organ prolapse or been worried about it, look at all these people who are walking around without symptoms. It's not impacting their life, and they are okay. But on the other hand, it also means, in my view, that there's a lot of people who are giving birth and are not receiving thorough checkups afterwards. We need more 4th trimester awareness, and also not all these people are people who have given birth in general. By that I mean not everyone who has prolapse is someone who's given birth, but in this study they were looking at people who had given birth, and so there's a lot of people walking around without getting the care that could possibly improve their life or prevent this grade 2 from turning into a higher grade of a prolapse. And I just think that's significant for us to consider. Okay, so who's at high risk for pelvic associated with pelvic organ prolapse, injury during childbirth, so not just vaginal birth. You can have a quote unquote simple, non-complicated childbirth with no documented injuries that can still place you at more risk. So it's a great reason to get checked out after a childbirth, even if there was no tearing or it felt like a really the birth went as well as you hoped that it would. If someone had forceps or vacuum used during their birth, that can place them at increased risk. People who chronically strain, so put more increased pressure on the pelvic floor, that could be someone who has constipation, hard time pooping, could be someone who has, you have someone who has like weakness in their legs and you go to stand up and you're like, I gotta get up. That little noise, right, that a lot of us make, that little noise is a momentary secondary pressure on the pelvic floor. Someone with like a condition such as COPD where they're coughing a lot of the time, that can put them at increased risk. Generally injuries from a surgery, menopause, that's because it's related to estrogen deficiency, has been shown to impact the tissues. Folks of Caucasian race are at increased risk, though I have to say, I'm not entirely sure that's just because folks of Caucasian race actually are at increased risk, or if it's just that we don't have as many studies done on people of color. Okay, poor lifting mechanics. So again, that's just because if you bend over to pick something up like a kid, or, you know, if you're lifting weights and you're holding your breath to get it up there, every time we hold our breath, we're straining on our pelvic floor. Folks of larger body size, sometimes that can increase pressure on the pelvic floor. And then if you have if you've been diagnosed a Marfan syndrome, which are both inherited syndromes, or hypermobility syndrome, like people tell you're double jointed or something, and you can bend your elbows and your fingers and a little bit further, that can place you at increased risk for pelvic organ prolapse. Okay, so treatment options for pelvic organ prolapse. I've already mentioned this, but here's that list again. You can look back at it later with a little bit more time. But more specific to me, so how does PT know what grade of pelvic organ prolapse I have? Well, during my pelvic floor muscle exam, again, I'm going to insert my finger into the person's vaginal canal with consent, and depending on how far what side of my finger I can feel pressure on is going to help me identify which organ is involved, and then depending on how far the organ has descended down my finger will help me determine what grade of prolapse someone has. So I think this is important to know. This photo on the left, this is what I visualize. Like it's been really bittersweet, you know, being just a couple years into this profession. I've had some really amazing patients, and when I get complimented by a patient, like, wow, this is not what I thought this was going to be like. This is way better. Or someone starts crying because they're like, I didn't know, I thought there was something wrong with me, or I was so scared to come in here. I've waited 3 years, 5 years, 10 years to come get help for this. A lot of times what they share is that they didn't seek help because they're scared that they'll go to a doctor and it'll be like the scene on the left where you're laying on your back, your knees are displayed for all to see, and you're gonna have all these people staring at you and being like, what is that? Oh my gosh, what is that? And unfortunately, I have had a couple patients who have had negative experiences where a provider doesn't have quite the training they need. And so, you know, they look at the pelvic floor and they're like, oh, I need to go get someone else to look at that. And then they come in and you have two people standing over you. That can really harmed some of my patients. And I'm hoping that the medical profession in general changes like that. But I just want to say that that's really not what pelvic health physical therapy is supposed to be like. And I think there's a lot of hope to find a pelvic health PT, even if I'm not the one that you choose to seek care from, who your experience will not be at all like that. So these photos over here are a little bit more symbolic of what a session might look like. And I should say all of these photos, they have someone laying on their back, looks like they're undressed from the waist down. But I think it's important to know, look at like the eye contact the provider is making with the patient. You should feel when you're getting a pelvic health eval done, like that your provider's really connected with you. They're explaining everything. They're asking for consent each step of the way. And also know that not every pelvic health exam or treatment session involves internal work, meaning you don't have to get undressed every time. And if you can go get pelvic health physical therapy with never getting undressed. There's so much that can be accomplished without doing an internal pelvic floor muscle exam. There's so much that can be accomplished with just talking back and forth. So whatever your comfort level with it is, there is an option for you. Otherwise, in terms of what pelvic health physical therapy can offer, well, what we're going to look at is your breathing patterns. We're going to look at your core and leg strength. We're going to look at the pelvic floor muscle strength, endurance, coordination, tightness level, if there's any tender spots or pain points. I test all of that internally, depending on how hard the person can do a pelvic floor contraction and squeeze my finger, how long they can hold the finger squeeze. And then there's a couple other tests we run, or I run patients through. And then this image over here on the right just shows some options for different positions to do prolapse testing, because some people, you might get tested by a provider laying on your back. You might build up the courage to go and be like, I think I have pelvic organ prolapse. I felt it one time. And you go and they're like, nope, didn't see anything. Well, maybe that's because your symptoms show up at the end of the day when your muscles are tired. Maybe that's because your symptoms only show up when you're in standing, or they only show up when you're squatting, because that changes how much everything opens in the pelvic floor. So just know that when you go talk to your provider, it's really important to share at what times of the day or in what positions you experience the symptoms. And it's okay to ask to get an exam done in different positions. And then we don't have a ton of time to talk about this today, but I'll leave this list here for you to check out later. Generally speaking, other things that I offer for pelvic health PT for prolapse would be talking about toileting habits, because we don't want you to strain or hold your breath when you're pooping. Sometimes that can put more pressure on the organs. We can talk about how to do splinting. If that sounds uncomfortable, we can talk about using a glove. We might go over your lifting mechanics. We might talk about the food and water that you're getting in, because if your poop is of different qualities, that can make it harder to poop or make you more constipated. And remember, constipation can put you at risk for prolapse, or constipation can make prolapse symptoms more severe. We're going to talk about how to prevent just having that increased intra-abdominal pressure, how to manage it. We might do stretches and relaxation exercises, because contrary to the stereotype that pelvic organ prolapse only happens in people with loose pelvic floors, sometimes it happens in people who have tight or painful pelvic floors, and we want to make sure we address that too. And then whether we do an internal pelvic floor muscle exam, or we do like a verbal exam, or we do an exam over clothes, we are going to come up, the pelvic health PT you work with should help you come up with an individualized exercise program that does not, like if you go to someone or you read online, it says just do Kegels. There should definitely be more specific things than that, because there's lots of different types of Kegels. There's different types, there's different durations you should hold the Kegel for, and not everyone needs the same thing. So again, this is really why you want to do, get an exam by some type of provider, just to get a baseline of where you're at. If we strengthen your legs and arms, sometimes that helps too, because again, go back to the standing up example or lifting. If my arms are stronger, that might make me hold my breath less. If my legs are stronger, that might make me stand up a little bit easier and put less pressure on my pelvic organs. In pelvic health PT too, the other thing that's really important is I refer patients out when I need to someone when they're, generally speaking, just to check out, make sure everything's okay. Also, sometimes I refer someone out to get a pessary fitting. I'll show you a picture of that in a second. And then sometimes I'll do soft tissue work, internal work through the vaginal canal, or externally over the saddle area, also over the glutes, the low back muscles, hip muscles, any muscles that are tight, because sometimes that can impact symptoms as well. Biofeedback, we don't have a ton of time to talk about this one, but you may have heard that there are these devices. I have a couple here with me. Actually, I have three. This is the Parafit. Here's one of the Kegels. This is an internal device. Here's an external device for a Kegel. I had a lot of fun passing this one around my office because it's external, so everyone can try it over close. But basically, they've come up with these devices that all cost anywhere from like $100 to $150, and typically you can connect it to your phone these days and you can play video games with it, or if you appreciate graphs like I do, you can look at a graph and it'll help you understand the strength of your pelvic floor contraction, if you're doing it all right, and it can help you set goals with your provider on how long you want to hold them. I will say I typically, it's not a last resort I give my patients, but there's just a lot we can usually accomplish with either tactile feedback, like with my finger, or with the patient's finger, or just again practicing having that awareness of your body. So there's an option to use biofeedback, but you do not have to. You all can go through these studies later on if you're really so inclined to be interested in them. But the biggest thing with these studies, I've got 3 of them included here for you, and they all list what type of stage prolapse someone has. Stages 1 and 2, the other ones have 1 through 3, and they basically all include some type of pelvic floor muscle exercise training for like 16 weeks or 6 weeks or something. And what they found consistently in all of these studies is that the people who do pelvic floor muscle training, that they do report improvements in symptoms. They show a decreased grade of the prolapse, so it's not quite so fallen down, and then improved quality of life. I will say that a lot of people ask, well, what if I have a grade 4 prolapse? Is that possible with PT that will go into a grade 0 or a grade 1? Research around that generally says no, but research around that says pelvic floor muscle training can still be helpful. It also says you could be a candidate for a pessary fitting. And then there's lots of other things that we can do in PT to improve your quality of life. Okay, so just breezing through these. Pessaries. So a pessary is a removable silicone device that's placed into the vaginal canal. Over on the right side, there's a few examples of those. It kind of acts like a bra for the vagina. Most commonly, it's going to be fitted by gynecologists or urogynecologists. The only provider I know in the Federal Way area who fits for pessaries is Dr. Beth DiDomenico. She's a naturopath at Federal Way Naturopathy, and I've had some patients get some really good results with her. And then here's a side view example of a pessary when it's inserted into the vaginal canal. So here's a different shape. Here's this one. A lot of people report positive impact with pessaries. And sometimes it does take a few fittings though, and it can take patience to figure out the right one for you. But if you get the right fit, some providers will say you can leave it in for 3 days at a time, a whole week at a time. Some people say you can leave it in for a few weeks at a time. You need to take it out at some type of regular basis and wash it, but it can be a really nice option for folks who don't want to feel that heaviness all the time, and it might help you participate in those activities that you've been feeling like you've been missing out on. Poise Impressa, this is something sold actually at most like drugstores. It looks like a tampon, but it's not, because it doesn't have the same makeup in it, so you're not at risk of toxic shock syndrome. But if you have a milder grade of a prolapse, this could be something you look into, where the way it's shaped, it can offer just a little bit of support. So maybe if you have a milder grade and you're like, oh, I wanted to go on a walk with some friends, and you just didn't want to feel those symptoms, you could try inserting this and see if that impacts your symptoms at all. External perineal support. So you can tell I'm getting into like some treatment options right now. So this is My Pelvic Floor Muscles. This is a pelvic health PT who's awesome. Offers a ton of resources online. You probably saw her logo a few slides back. And so if you go to her website, you can get some more information about this sling. I will say I did try this with one of my patients, and they were not very impressed by it. I also was not very impressed by it. I think that it would be more beneficial for someone who has a lesser grade, like a grade 1 or 2 prolapse, and not someone who has a grade 3 or 4 prolapse. And then Squatty Potty, you might have heard of that. I love this photo. So I feel like people are like in marketing are always portrayed as like having the best time pooping, when the reality is a lot of people struggle with it. And so this photo just makes me laugh. But the reason it can be helpful to sit on some type of stool and lift your feet there is because it changes the angle of the rectum. So if you look over here, this is the angle represented when someone is squatting on a toilet. So it's actually straight, more upright, and allows poop to come out easier. When someone sits with their feet flat, or they're on a toilet where their feet hang off, the angle is just a little steeper and sometimes can make it harder for poop to come out. Okay, so final things to consider. I'm so sorry we're running out of time to talk about using a mirror to do an exam, but you're welcome to contact me for a free consult, and I'd love to go over that. Also, this pelvic health PT, who I'll share her contact info on the next slide, the vagina rehab doctor, she has a ton of resources online and some videos on Instagram where she talks about doing that. So does the other pelvic health PT, who's at www.mypfm.com. And those are, again, excellent resources to check out. But I hope this presentation has helped you consider scheduling an annual visit or one visit with a pelvic health PT, talking to your gynecologist or PCP if you suspect you have prolapse, and then or making just a general appointment with an orthopedic physical therapist to assess your posture, your lifting mechanics, your core strength, your breathing mechanics. A lot of words on this slide. I have this really awesome patient who wrote me this testimonial of their experience with pelvic health PT. I almost didn't include it because she talks so highly of me. I felt like I was bragging about myself, though I also wanted to model. I tell my patients all the time that they should be proud of themselves and that they should really celebrate things they work hard at. And so this is a patient case I'm really proud of. I'm proud of her and the work. Here is a couple things she said, which is that she found me after being told by a doctor at a local women's health clinic that there was no such thing as physical therapy for pelvic organ prolapse. She had a higher grade prolapse, and she felt that I listened and answered all of her questions. And she felt some hope leaving her first appointment. So I would say when you go find your pelvic health PT, and it's like finding a counselor, you should really find one who you vibe well with. If you find someone who's not listening to you or is dismissing you, please give yourself permission to go find somebody else. Everyone is deserving of having a provider who really listens to them. And I just love that she celebrates, she says, I have gained confidence that there is no shame in what happened to my body. This body bared 4 beautiful children. And she just could not believe that pelvic health PT was not mentioned once to her by her other healthcare provider. She started talking with her daughters-in-law, and female friends about taking care of their cores. I love that. And so I really appreciate that this patient spoke up about her experience, and I'm hopeful that her sharing this will encourage who's ever watching this to consider talking to a friend or a loved one or a provider about their symptoms too. Okay, so resources, promise I'm almost done, y'all. Dr. Janelle Howell, she's a vagina rehab doctor. I highly recommend checking her out. Janice Mitchell, she is my pelvic floor muscles provider. Also awesome, please check her out. www.pelvicrehab.com, that is a directory where you can go and search for local pelvic health PTs. So if you type in like an area, zip code or something, it'll put a little map dot where everyone is. Another cool resource to check out is the Herman Wallace blog. And then, so this is us, Northwest Wellness. I've got the website here, our email if you have questions, our address. We're pretty near Costco and the exit for Highway 18. I will say if you do decide to schedule that I do have a good amount of a waiting list right now. I believe I want to say August, September is the next openings I have for new patients. And this can just happen because there's so few pelvic health PTs in this area, but I do recommend calling if you have any questions. If you do come see me, I also need you to get a referral from a provider that could be your PCP or a gynecologist. But anyways, that is it. Thank you so much to everyone for listening, and I hope you found this presentation helpful. And I am happy to take any questions that you have for me.
Thank you so much, Dr. Herron. Wonderful presentation.
Well, thank you.
You're very welcome. I'm going to check Facebook Live here, see if there's any questions from live.
Yes, and also just looking at these other questions, a little white thing in front of the bladder. Yes, looks like Jennifer answered to another Jennifer. That is the pubic bone, correct.
Good job, Jennifers. Well, okay, folks, we're going to say goodbye to our Facebook Live friends and open up the questions for the Zoom meeting. We thank you so much for watching, and definitely follow the links that I had posted in the comments to get a hold of Dr. Rachel. So thank you so much.